U.S. hospitals are in desperate need of foreign nurses. With a nursing shortage in America, several hospitals are going overseas for help. And it may be timely. This year, foreign professionals, including nurses, may apply for twice as many green cards as in previous years. Because the coronavirus epidemic shut down U.S. consulates, these vacant visa slots are being allocated to qualified employees. In her 18-year career, Amy L. Erlbacher-Anderson, an immigration attorney in Omaha, Nebraska, has never seen such demand for foreign nurses. If the U.S. consulate offices can review all the applications, she believes they will be authorized to visit this year. As a result of pandemic burnout, many nurses have retired or left their professions in the United States. Meanwhile, coronavirus cases fluctuate, putting enormous strain on the healthcare system. According to a recent research from the University of California, San Francisco, there is a 40,000 nursing shortage in California alone. Hospitals are employing traveling nurses to fill the void, but it is costly. Hospital officials believe there aren't enough nurses graduating from U.S. institutions to fulfill demand. A growing number of hospitals are increasingly employing nurses from the Philippines, Jamaica, and other English-speaking nations. That's because the fiscal year finishes in September. Every year, the U.S. gives at least 140,000 green cards to those migrating permanently to the nation for specified vocations, including nursing. Most go to persons already in the country on temporary visas, although some go to foreign employees. Recruiters are hoping that some of this year's 280,000 green cards will be snatched up by nurses looking to work in the United States' pandemic-weary hospitals. The Biden administration has taken initiatives to assist international healthcare professionals affected by the epidemic. Work permits for healthcare employees will be renewed faster, allowing those foreign nationals currently in the country to stay employed. Consulates were instructed to prioritize applications for staff at pandemic responding institutions last year, an agency official said. The Omicron variant outbreak in the U.S. has exacerbated hospital staffing shortages as ill personnel, like many others, have been forced off of work due to the highly infectious virus. Since the pandemic started, Sinead Carberry, president of AMN Healthcare's Nurse Staffing Solutions, claimed demand for overseas nurses has increased 300 to 400%. Recruiters are increasingly looking to employ nurses abroad since there are immigration visas available, she added. International recruiting should be scrutinized more closely, says National Nurses United, a group representing 175,000 registered nurses. The organization claims hospitals pushed away American nurses by understaffing, even before worries about worker safety and rights developed during the COVID-19 outbreak. Assistant Director of Nursing Practice Michelle Mahn said many foreign nurses sign year-long contracts with employers, making it difficult to speak out about labor or patient safety issues. She claimed hospitals are hiring foreign nurses to replace staff who left during the outbreak. Administration claims there aren't enough American-trained nurses. In addition to training more domestic nurses, Patty Jeffrey, head of the American Association of International Healthcare Recruitment, said the U.S. should let more international nurses in. She agreed that bringing in more nurses would need legislation. Portugal's Jorge Almeida Neri, 26, arrived in December, despite he started his journey before the outbreak. He claimed the infection delayed an international nursing test and a consular interview took 4 months, but some foreign nurses he knows waited far longer. He applied for his present position at a Virginia hospital approximately a year ago. It takes longer to find job in the US than in Portugal, according to Almeida Neri. While hospitals may request extra visas, this is not a certainty.